A very good morning to everyone. The topic of today's presentation is management of sunken cheeks using digital dentures and 3D printed cheek plumpers with integrated attachments. Sunken cheeks can occur due to maxillofacial bone resorption, facial muscle atrophy, tooth loss. This can lead to an aged appearance and also can have a psychological impact on the patient. Conventional treatment approaches involves fabrication of cheek plumpers, which can be retained by means of magnetic attachments, which may weaken over time. Springs, they cause discomfort and are mechanically complex. Direct acrylic extension, they add bulk and affect the comfort and the aesthetics. Digital workflow in such scenarios offers precision using CAD-CAM for customized designs and 3D printing for efficient, accurate components, minimizing the need for chairside adjustments. A 70-year-old man presented to the Department of Prosthodontics with a chief complaint of difficulty in eating and a hollowed facial appearance. Extraoral and intraoral examination revealed sunken cheeks due to loss of buccal fat pads, along with completely edentulous maxillary and mandibular arches. The treatment plan involved the fabrication of CAD-CAM dentures and 3D printed cheek plumpers with integrated attachments. Digital scanning of the maxillary and mandibular arches were performed using an intraoral scanner. The resultant STL files were imported into a CAD software program to design custom trays. The area of the spacer adaptation was marked on the STL file of the mandibular arch, followed by an offset of 1.3 millimeter to create a uniform thickness across the marked region. A tissue stop was designed in the anterior crest region to ensure proper custom tray sitting. Then the entire tissue surface of the STL file of the mandibular arch along with the designed spacer was selected and given an offset of 2 millimeter to create a custom tray with 2 millimeter thickness. The maxillary custom trays was designed with a similar technique as that of the mandibular custom tray. The STL file of both the custom tray were then exported to a slicing software. Subsequently, the 3D printing of the custom trays were done using a biocompatible resin. Border molding and secondary impressions were made. These impressions were then scanned using a laboratory scanner. The STL files of these impression scan were inverted to create virtual mastercast. Then a virtual base was also added to the virtual mastercast. This was followed by designing of denture bases over the virtual mastercast, followed by their 3D printing. Then the jaw relation was recorded and the jaw relation was digitized using an external laboratory scanner. Then, after digitization of the jaw relation, a trial denture was designed in a CAD software, followed by 3D printing. When the trial denture was clinically evaluated and wax blocks were adapted over the buccal flange area of the trial denture, then the trial denture and the wax blocks, which were anatomically contoured, were scanned with the help of laboratory scanner. Then the scan of this trial denture and the wax block was superimposed with the trial denture design to transfer the cheek plumper area. This was followed by anatomically sculpting the digitally designed cheek plumper. Then these are the images showing the final verification of the cheek plumper adaptation. Then matrix and patrix attachment components were designed in the CAD software for the attachment of the cheek plumper. The total height of the matrix attachment component was 5.4 millimeter with a radius of 6.9 millimeter, while the total height of the Patrick's attachment component was 4 millimeter. The spherical portion had a radius of 1.15 millimeter, while the vertical component had a total height of 1 millimeter. Then the placement of the attachment components in the denture base and the cheek plumpers were done. Additionally, an anti-rotational feature was also incorporated in the cheek plumper design. These are the final images of the cheek plumper along with the matrix and the Patrick's attachment components. Then the final denture base and the cheek plumpers were 3D printed using a biocompatible resin along with the 3D printing of the final teeth. Then a silicone ring was placed in its slot in the matrix attachment component and cheek plumpers were attached. to the matrix attachment component with the use of the integrated matrix component. These are the images showing the insertion of the final denture. As evident in the pre and post rehabilitative views, there is significant enhancement in the aesthetics. So the clinical outcomes being secure attachment of cheek plumper using silicone ring system, and over a 3-month follow-up, minimal food lodgement was seen and no detachment of the cheek plumper was noted. The digital workflow provides several advantages such as precision in fit and design using CAD-CAM and 3D printing. Integrated attachment system enhances the stability and eliminates the need for external adhesives. Also, reduced chair side adjustments and minimal foot lodgement were some of the key highlights of this case. The challenges being it requires investment in advanced digital equipment and expertise, learning curve for digital process. Components like silicone ring may require periodic maintenance. To conclude with, this was an innovative approach for the rehabilitation of a geriatric patient with sunken cheeks. Digital technology was utilized, and CAD-CAM dentures were fabricated, and 3D printed cheek plumpers with integrated attachments were used, which provided a reliable and comfortable solution. In this case, the digital workflow led to aesthetically pleasant prosthesis, and minimal complications were noted over a 3-month follow-up period. These are my references. Thank you.